Great. Okay, so second part of the shoulder mobilization is a bit more technique oriented. You can use a bit of oil, but I would suggest to keep it on a dry side because you can really glide too much. So I'm going to skip the effleurage, pétrissage, all of that. Yeah. Good. So now I get into the shoulder mobilization itself. Now the idea here is that you're moving an area, and when you're moving the joint, one muscle will become tighter because you're stretching it, and then you're relaxing it. Yeah. Come closer into here, and I want you to envision the upper trapezius. And I'm using the upper trapezius as an example for two reasons. First, it's a very common problem. Yeah. There is even a name for pain in the trapezius muscle. It's called trapezius myalgia. Yeah. So what is myalgia? Pain. Pain in a muscle. Yeah. Trapezius, pain in the trapezius muscle. Because it's very, very common, you don't see deltoid myalgia in any book, yeah? But trapezius myalgia. Yeah. The way that people hold their shoulder, the stiffness there, the emotional stress, physiological stress that happens there is a phenomenon. And it's a good subject to why the body builds this way, but we live it. That's how it is. So let's take trapezius. And now, when I do stretch and laxity, what do you think happened into the muscle? Stretching. So you're losing it up, but stretching.
You like allowing the blood circulation into the muscle.
You're what?
Pressing it
Blood circulation into the muscle.
What happened to the blood circulation?
Increased.
Yeah. How? How does it increase?
It's like a pump, basically.
It's like a pump. Remember we did this towel, when you're taking the towel and you're stretching it and then relaxing, stretching and relaxing. Same, but here you're using mobilization to do that. Yeah. So imagine that you have a muscle here and you compressing it and stretching it, compressing it and stretching it. If you do that, if it would be fluid in here, would you see that every time you're compressing, fluid squeeze out and you're stretching, fluid come in? Yeah? So you're improving blood circulation. Good. So let's take that into action. So you put your leg in here. You might need to lower yourself down. And what I'm doing, instead of keeping the hip very close, I actually send it a little bit backward like I'm about to sit. And then I start a few times to move that, to move the shoulder. So when I go this way, downward, I'm stretching it, and then I can compress it very much. So don't end up doing something in the middle. I want you to really feel the stretch, and it's a bit of an art because you're not stretching, yanking it, but you coming to the end of the stretch and then increasing it a little bit more. Yeah? And then compressing it. And now, when you're doing that, you can massage, it's kind of a pétrissage really, onto the muscle, or even nice compression point into there. You can hold it, or you can continuously do that. Nice pétrissage. When the muscle is in lax, it's very easy to feel where the tender point or the trigger points are. You can even use your knuckles and to do some nice stretching. So actually go opposite, you know. I'm stretching it and then my hand go all the way to the suboccipital area. And I can stretch myself as well. Yeah, so again, from here, other muscles here. Yeah, can you bring the towel, someone towel, maybe this one? Yeah, Thank you. So, remove it. So you can put a towel on the back to here. Yeah, you can put that, and it's very easy now to work on the muscles around. I'm working now. Do you actually see that part of the bone? Yeah. And that is the lateral side, the outside of the triangle-shaped bone, and this is where the teres muscles are. And what the teres muscles doing, they attach to the arm. Now look what happened. If these muscles are short, what happened that you cannot move the arm very easy because it attached to that bone. So this bone can't move. So what happened that other things start to, the whole shoulder can go up. Yeah, and other complex movement can happen. So this area, you can just put nicely your hand in here. And it's very gentle because usually that's an area that nobody's massaging. How's the pressure?
Good. You can go deeper if you want.
Yeah?
Nice.
Okay. Good. So this is another alternative. Right. Another thing, you can bring the hand over here. Now, be careful when you do that, not to take the hands too upward. Yeah? Natural place, and then same thing again. Traction. Yeah? Or even you can use this hand over here. A nice, I'm pushing this hand over there, and that hand on the opposite side. Or on the scapula itself. How many of you lately just did something that, besides when you are yawning and stretching, most of our arm now is down and it drags the whole skeleton. So the rationale of that is to kind of stretch almost there. And you can take it further even later on. You can see that you can have some technique on the ribs to really start to mobilize the ribs even a little bit down this way. So it's the same idea of loosening it, you know, getting more isolation between. You see someone that's stiff, that you ask them to raise their shoulders, it all comes to be this way. And everything from the ribs come up with it. Try to, it's like isolation. Ribs down, you know, even to the side. We'll do after that side stretching, you know, to have more isolation between these muscles. Okay, let's come and turn onto your back. Yeah. This way, yeah. Good. Okay. Let's take this one. Where's the oil? Thank you. Right. Okay. So what can you do down here? Right. Philip, you do a few times, you see which movement you can do. It's nice to do rolling. You see that probably what you're doing is slightly smaller. Maybe the camera can come from here so you can see the whole movement. Yeah? Don't be afraid. Take it on a healthy person. Take it to the full range. Really to the full range. Now, look what happened to when I'm stretching the neck. You see that his head starts moving? Yeah? Turn your head this way. If I turn the hand in the opposite direction, then I can create a nicer stretch, because this is the side of the upper trapezius. It goes all the way to the head. So, so this hand over here, you can use the same thing as I did facing down is facing up, yeah? Which is compression and stretching. And you're just looking for trigger point. You can hold it this way. So what I'm doing, I'm having my finger really digging into the back of the upper trapezius and just holding it really. For that, I'm using the hook of the table. I don't lift, but actually it's like a bottle, sorry?
Like a lever.
Like a lever, yes. When you open, remember when you used to open the bottles of beers, when you have that kind of lever, you know, the can opener. And even further, in this position, if the camera can come closer this way, what you can even do further is to bring your hand onto just the opposite side of the spine. Yeah? So I'm lifting myself, I'm lifting his arm so I can go in. And now, if the spine is here, my hand go just underneath and hook to the spine. Do you understand where my fingers are? And what I'm doing then, if this is the spine, I'm going underneath. Then I start to mobilize vertebra after vertebra. Just like that. Very easy. Very easy. And because it's a short lever, it's also very powerful. Because I'm on the spine itself. I'm actually on the side of the bone and I'm pushing the bone. Feels a bit bizarre for you maybe to start with. Do not do it on the neck because the neck is movement works differently.
Are you pulling towards you?
Yeah, I'm pulling towards me. Yeah, and you can do that with tractioning of the shoulder. It's like a whole spine and shoulder movement. How does it feel?
A bit painful, but I can feel it works a little on my left arm.
Really?
Yeah.
Mm-hmm.
Especially because they're on the rhomboids.
Okay.
Yeah.
Okay.
And really,
So
really
that-
can go really deep.
Yeah, you can go very deep. Yeah. Another one, you can do traction for the whole upper trapezius while you're working opposite direction. Your body goes down and your other hand goes up. Just like that. Good. I think that's really a lot. Again, looks kind of easy, but when you're getting there, first to just remember what to do and how to put your body, that's a struggle. So it's good to have this kind of all-time round position to kind of be able to just start knowing where you're going, what you're doing, and then after that, take it from there. Okay?
Okay.
Fantastic. Good.